Thank you for inviting me to speak on behalf of Therapy Services in Cwm Taf Morgannwg University Health Board. My name is Natalie Potter. I have worked as a dietitian for the Trust in a number of specialties for 17 years. It is my pleasure to talk to you about our Community Therapies Hub on behalf of the team. In March 2020, in response to the unfolding COVID-19 pandemic, the 5 therapy services of physiotherapy, occupational therapy, nutrition and dietetics, speech and language therapy and podiatry were united in an innovative service model called our Community Therapies Hub. This rapidly developed service was built on a 7-day-a-week single point of access model for patients in the community, including own homes, nursing and residential care, as well as field hospitals as required. Referrals were accepted by our admin team using a dedicated line before passing to a skilled multidisciplinary team of experts in each therapy area. A team of senior clinicians met daily in a socially distanced way using one of our physiotherapy gyms. New referrals were allocated to the appropriate clinician based on primary referral need. This clinician would fully triage for all other therapy needs and refer on to additional services as required, offering a one-stop shop of assessment. Our wins. Removal of barriers for prompt and holistic therapy intervention. The Hub is an excellent example of prudent and responsive healthcare. Traditionally, if an additional issue was identified by a clinician during consultation, the staff member would then need to make an onward referral and the patient would be placed on another waiting list in another service, causing delay to treatment and outcomes. A practical example of this could be, as a dietitian, often we may pick up swallowing issues, which would then require a referral to speech and language therapy, which may delay a full assessment from the dietitian. We noted the average response time was 0 to 1 day for most patients, ensuring all patients got full multidisciplinary assessment promptly. Point 2, cross-professional learning resulting in more comprehensive holistic care. This experience provided an opportunity for in-depth learning and appreciation of other therapists' expertise and roles, providing a direct impact on current and future care. For example, physiotherapy and podiatry may not work together as directly as they did in the Hub. However, foot issues could have a marked response on an individual's mobility and overall outcomes. 3, our experience of telehealth, which was new and had massive benefits to future care. This was our first experience of using telehealth. Our PREM surveys identified 100% of patients scored 8 to 10 out of 10 for confidence to carry out advice given by telephone. Patients' average satisfaction scores were 8 to 10 on a visual analog scale. This illustrates going forward, we don't need to physically see everyone to attain good outcomes and excellent patient satisfaction measures. Point 4. A rapidly established new team of expert clinicians work together with dynamism, pace and autonomy to lead and evolve a new and innovative service. We had a fantastic team. All team members fed back on the strong team dynamics with shared goals around a key purpose of responding to the unfolding pandemic and caring for vulnerable people in our community. Many of us had never met previously, and I really want to identify how strongly we came together as individuals to lead this initiative in an extremely challenging time, both in our own personal and professional lives. So slide 3, our future learning and reflections. We recognise we need dedicated resources and workforce. Our Hub went live within only a few weeks of planning. Going forward, we have learned we need more practical resources such as IT equipment, better access to virtual platforms, rooms, telephones, as well as Hub staff dedicated working solely in this service and admin support across all therapy departments to formalise our admin processes. Point 2, we need improved triage and referral procedures. We recognise triage could be improved if carried out at the point of referral instead of a clinician recontacting the patient. Suggestions include using therapy technicians to facilitate this process or enhanced training of our admin teams to support them with this task. We looked at our patient groups, COVID versus non-COVID. The original focus of the Hub was to care for COVID patients, discharged from acute services or recovering at home. Referral statistics show the majority of patients referred to us were not COVID patients. Steps have been taken to identify these patients in the community and their rehab needs as other services resume to care for our non-COVID community patients. We need dedicated time for service review and development. The hub service was new and rapidly evolving on a daily basis. Change was required to fit the model. Hub staff found this took up increasing amounts of clinical multidisciplinary team time and recommend specific time is set aside each week for this purpose. In conclusion, I would like to thank each and everyone in the therapies teams involved in the setup, development and day-to-day running of the community hub. Looking back, I feel we achieved something groundbreaking in a time of great uncertainty and pressure, which will go forward and influence our practice and care of patients in our communities in the future. I think what we achieved is tremendous and I hope you will agree. Thank you for listening today.